Hi, welcome to the Fit and Healthy Today show. Today's topic of interest will be on high blood pressure or healthy blood pressure, maintaining healthy blood pressure. We're going to be discussing the symptoms, the everyday things that you can help to prevent high blood pressure or lower blood pressure. We'll be discussing also supplementation that can aid lowering blood pressure. The symptoms of blood pressure, normally I know when my customers come in the door, sometimes they'll have this slight red face. They'll talk about a little bit of tingling. They'll get headaches. They perspire, sometimes profusely. They get fatigued, tired all the time, and they're just not feeling themselves. The standard nomenclature that they use to describe blood pressure is pre-hypertension, stage 1 and stage 2. Pre-hypertension, by how the medical establishment has diagnosed it or put it at, is anything that's 130 and above or 80 and above on the diastolic. Stage 1 is 150 to 159 on the systolic and 90 to 99 on the diastolic. And then stage 2 is anything 160 and above on the systolic and 100 on diastolic. Stage 2 is kind of a, it's where the blood pressure rises so much to where you get concerned whether or not you potentially could have a stroke, a heart attack, or kidney failure, or literally bursting a vascular system anywhere in the body, especially if the vascular system is or lacks good integrity to it. 1.5 million Americans have heart attacks every year in the United States alone. Obviously, kidney failure, strokes are also related, in addition to having heart attacks, with the high blood pressure. What high blood pressure means is basically it's a measurement that measures through the vascular system the amount of pressure it's taking the body to push the blood through the veins and arteries. We have methods or ways of within our own selves before medications or even supplementation that we need to look at that help prevent and also help control genetic tendencies towards high blood pressure, as well as lifestyle issues with blood pressure. When we examine and look at diet, potassium-rich diets, potassium and magnesium. In today's methods of farming, oftentimes, and the methods of eating and the foods that we're eating, are lacking magnesium and potassium. And these are key minerals that help keep blood pressure down, that relax the vascular system. And without them, you'll get a vasoconstriction, and then the blood pressure rises. So oftentimes, just simple supplementation with potassium-rich foods can be very, very helpful in, with blood pressure. Looking at the sodium and potassium ratios as well, oftentimes people are eating very sodium-rich diets. The potato chips, the soda, so many things that have sodium in them, canned goods, very high in sodium. So just getting that potassium and sodium ratio back in balance is very critical for keeping blood pressure at a normal level. Certain chemicals, ibuprofen, which I know a lot of people use for pain, arthritic pain, baking soda or products that have baking soda, particularly baked goods, diet sodas, artificial sweeteners, they all raise blood pressure, and these are things that we tend to use in our everyday life. So being aware, if you do tend to have a problem with blood pressure, to avoid these types of chemicals as much as possible. Increasing your fiber in your diet, getting toxins and things out of the body. Certain, as we noted in here, certain chemicals and toxins will also drive up blood pressure. Pesticides will drive up blood pressure. Any type of chemical that the body sees as being foreign causes inflammation and can cause vasoconstriction, which can raise the blood pressure. So fibers help remove some of these toxins. They help you eliminate a little bit better, well actually a lot bit better, to remove these toxins from the body. Eating lots of vegetables, and if you're not diabetic, fruits. Fruits we have to be careful because they do raise blood sugars. But the alkali forms of food, live, wholesome juices. There's one study on celery, for example, eating 4 stalks of celery per day, just 4 stalks, 4 ribs of celery, lowered blood pressure an average of 12 to 14%. So if you're one of those borderline people or moderate hypertension, just eating celery or juicing celery or celery juices along with greens can help lower your blood pressure and bring it back within normal range. Something so simple. And since Americans don't tend to eat their usual 3 to 5 servings of vegetables a day, you can see why maybe the contributing factor on the lack of minerals and the lack of vegetables that help reduce inflammation, keep the fiber levels up, help with keep the blood pressure down. Eating good fats in the diet, things like walnuts, almonds, pecans, fish, avocados, all those things help reduce inflammation in the vascular system, and they do slightly keep the blood a little bit thinner. They keep it from clotting so readily. They keep it smoother. It keeps the vascular system smoother, so you don't end up with these buildups and these clots that can tend to raise blood pressure as well. When we look at meat consumption, and I know there's a higher segment of the population now that are becoming more and more vegetarians, but eating particularly high-fat meats raise a marker called a homocysteine level. And that homocysteine level that physicians can test you for is a marker that can tend to indicate whether or not you're higher risk for having strokes, blood clots, that type of thing. So if you do eat meat, eat leaner pieces of meat. Your fish, your leaner portions of your chicken, your lean beef if you're going to eat beef. So, animal sources of protein are a part of our society and most of our diets, but once again, lean cuts. Just something to be aware of too. MAO inhibitors, which are oftentimes mostly utilized for depression and for blood pressure as well, and other things. There are certain types of foods that you eat or that you can eat with these MAO inhibitors that can raise blood pressure. I mean things like almonds, certain types of liver, cheeses, very common types of foods that will raise blood pressure if you're taking these MAO inhibitors. So if you are on an antidepressant or on a MAO inhibitor for whatever purpose, you need to look up online, or hopefully there's something on the warnings on your medications that indicate these tramamine or tramine-rich foods that can raise blood pressure. Being aware, because if all of a sudden you're on a MAO inhibitor and my blood pressure goes up, why is that? You need to look at the diet, because foods in their own way are medicines as well, and they can affect their chemical reactions in the body, and they can affect the blood pressure. Exercise. There's a lot of studies out there that support just 30 minutes a day of good exercise, and it doesn't have to even be extremely vigorous. Just a good walking the dog, lifting some weights, some Pilates, something that gets the heart and the blood flowing and moving. Because what that does is it gets the vascular system exercised, okay? So when you exercise, blood starts pumping, it exercises and keeps the vascular system, the heart, the brain, other things in very good working order. So exercise is very important for keeping blood pressure as well as blood sugars down, as we've discussed in other shows. Sleep. The lack of sleep can drive up blood pressure, but also keep in mind if you do have high blood pressure, it is readily indicated, and you tend to have sleep issues or snoring issues, it is now indicated by most good physicians that you go through a sleep diagnostic test to check for sleep apnea. Sleep apnea robs the body of oxygen and therefore raises the blood pressure. So if you have high blood pressure and you tend to snore, or your wife or your husband tells you you snore, it may not be a bad idea to get checked for potential sleep disturbances as being a contributing factor to your blood pressure. Drugs that can raise blood pressure, okay? Diuretics, and there are high blood pressure medications that are diuretics. So being aware that diuretics deplete potassium and magnesium levels, and as we discussed earlier, potassium and magnesium is vital to keep blood pressure down. These diuretics can raise the blood pressure. So being aware of that, you need to make sure that you either supplement with potassium and magnesium or eat very, very potassium-rich foods. Most of our foods nowadays don't contain proper amounts of magnesium, so it's very, very difficult to get ample amounts of magnesium without supplementation anymore. They estimate about 92% of Americans are magnesium deficient. And magnesium, and not just with blood pressure, it helps with bowel movement, it helps you sleep, it rests, it helps with anxiety. So being aware of that, those diuretics can rob the body of those really, really important minerals. Allergy and cold medications. Antihistamines. Allergy seasons, you're on a high blood pressure medication, you're on an antihistamine, pew, there goes the blood pressure. So finding alternatives, homeopathics or naturopathic methods of working with allergies. And then watching your blood sugar levels, because those can tend to trigger allergies even more. So being aware that these cold and allergy medications, they raise the blood pressure, or they can raise the blood pressure. I found some very interesting statistics that I think are pretty important to be addressed, that I think the public needs to be very, very aware of. I handled medical malpractice cases in a past career. I was a mediator for insurance companies, and I would defend doctors, and I would go in and mediate cases. When we're looking at when it is time to have or utilize a blood pressure medication, I look to the experts, and the American Journal of Cardiology, which is what we call the expert medical journal in cardiology, 6 separate studies indicated and showed that drug therapy for high blood pressure provided no benefit in borderline to moderate high blood pressure. No benefit. So those people that are under that 160, no benefit, according to the American Journal of Cardiology. In the Journal of American Medical, JAMA is what it's known, treatment of hypertension is one of the leading reasons why people go to the doctor. Okay? So when you look at, you have all these wonderful visits for hypertension, most of which are below 160. It generates a lot of income for physicians. It generates income for pharmaceutical companies. So looking at our own medical journal recommendations and using our logic skills tells us that, hey, if we can find something else to bring that blood pressure down when we see no benefit in border to moderate high blood pressure, I think that's a better option, considering the side effects that go along with these medications. Impotence, dizziness, weakness, weight gain, the list goes on. So before you consider a high blood pressure medication, you need to look at your options. Discuss it with your doctor or your healthcare professional, and remember this data and this information. Okay? Don't just ignore it. That's not my purpose or what I would suggest under any circumstances. It shouldn't be ignored if it begins to be pre-hypertensive or stage 1. And surely don't ignore it if it's stage 2. But there are other ways that you can lower blood pressure without the side effects of medications, under the supervision of your doctor. Some of which we've already mentioned. There are supplements that can be, that are very well researched, most of which, actually all of which, are backed by studies either here in the States, Japan, Europe, and other countries that we would consider of equal quality in double-blind placebo medical studies. Magnesium we've discussed earlier. 6 to 12 grams of magnesium per 2.2 pounds of body weight. So if you've got a 150-pound person, you're going to need probably right between 400 and 600 milligrams of magnesium to help keep that blood pressure down. Magnesium in other countries